so glad you guys find this helpful. You guys are literally the reason why I do this. And even if it only helps one person, that's more than enough for me to keep going. Nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect. Select all that apply. A, thirst. For this question, we need to know the signs and symptoms of hypoglycemia or low blood sugar. Recall that thirst is a sign of hyperglycemia. Remember the 3 P's for hyperglycemia: polyphagia, polydipsia, and polyuria. So excess hunger, excess thirst, and excess urine. So no, for this patient who has low blood sugar, we would not expect thirst. B, palpitations. When their blood sugar is falling, they may also develop palpitations. When the blood sugar falls, the sympathetic nervous system is activated. Then norepinephrine and epinephrine are secreted, which causes the palpitations. C, diaphoresis. Diaphoresis is also a sympathetic nervous system reaction. One trick that helps me remember this is cool and clammy need some candy. Because if they're hot and dry, that means their sugar is high. So if they're cool and clammy, they need some candy. D, slurred speech. So when the patient has low blood sugar, that also means that their brain isn't getting enough sugar to function properly. This in turn affects the central nervous system, which is why the patient would have neurosymptoms. We would expect this patient to have slurred speech because their central nervous system is deprived of sugar. E, hyperventilation. So let's think about it. If their central nervous system is down and they're having slurred speech, do you think the patient would be hyperventilating? No, the patient would not be hyperventilating, and they might even be unconscious if they have extremely low blood sugar. The patient would be hyperventilating or have deep and rapid respirations when they're in DKA, diabetic ketoacidosis. The patient has rapid respirations in DKA because the body is trying to get rid of extra CO2. The answers for this would be B, C, and D.